Hello and welcome to this introductory video that will be introducing you to the axial skeleton, the bones and some specific landmarks of the axial skeleton. So what do we mean when we say axial? In terms of the axial skeleton, we are referring to the skull and the vertebrae and the ribs. So everything along the axis. The rest of the skeleton, looking at the upper limb, the shoulder girdle and upper limb, the hips and lower limbs, that's the appendicular skeleton, and that will be covered in a different video. So today we will focus on the axial skeleton, and we are going to start with some of the bones of the skull and some of the landmarks of those bones. So a landmark is just a part of a bone that we find particularly useful to name, typically because it's related to another anatomical structure that we might be referring to. The skull is super complicated, and we are not going to be studying all of the bones of the skull, just some selected bones. So we're going to start here with the frontal bone. Okay? So here is the highlighted frontal bone on a skeleton, an image of a cadaver skeleton. And here's a graphic, and you can see that the frontal bone is right here. And we talked when we looked at regions that this is the frontal region related to the frontal bone. And you can see here that the skull is composed of many different bones that are sutured together. And these seams are called sutures. When we talk about joints at a different time in Biology 231, we'll talk about some of those sutures. So there's the frontal bone. Then we have two parietal bones. Okay? So here is one of the parietal bones, and there's an accompanying one on the other side. We can see that right here. So the frontal bone here articulates with the two parietal bones, and those two parietal bones are fused with another suture down the center of the skull. And I will give you one guess as to what the lobe of the brain is that is deep to the parietal bone. Next up, we have our two temporal bones. Okay? So here we can see the temporal bone. You can see how it sort of comes forwards and sutures right there with what we would think of as part of our cheekbone. And here again, here's the temporal bone, and we have one on each side. So there are two temporal bones. And now I want to introduce you to our first landmark, okay? And that is the external acoustic meatus. So we can find that right here, or on this image right here. And basically that is a hole, okay? It's a hole in the bone, and that's where sound enters the skull. The sound waves enter the skull that vibrate our tympanic membrane and allow us to hear. Okay? So that external acoustic meatus is the actual hole in the bone itself. So right there. Okay? Next up, we have our occipital bone, and this is a bone that we can typically most easily see with the posterior view. Okay, so here's the posterior view. Oh, and this gives you a nice image of the suture here between the two parietal bones. Okay. You can see the occipital bone here in this lateral view as well. Okay. And you can see it in this superior view. The occipital bone is all of this area in here. Okay. All right, so moving forward, we have our maxillae, which are part of the upper jaw here. There are two fused bones. If you were just referring to one right here, this would be a maxilla. Fused together, maxillae, but it's Latin, and I'm not going to fuss about that. So maxilla, maxillae, we're on the right track. Continue on through the skull here. Okay. We have the lower jaw, which is the mandible. So you can see that right here, or right here in the lateral view. You may have heard people refer to TMJ, okay, having issues with their TMJ, and this is the temporomandibular joint. And it makes a lot of sense when we think about the name of the joint, because here's the temporal bone, here is the mandible, and the joint, the temporomandibular joint, is where those two bones come together. And you'll find that many joints or articulations refer to the two bones or the two portions of the bones that are coming together. We also have our two nasal bones that make up the top of the nose, the bridge of the nose. The rest of the nose is made up of cartilage, which is why it doesn't stick around when we're just looking at a skull. So you can see right here the nasal bone, conveniently named. We also have our two zygomatic bones that make up part of the orbit of the eye socket, as well as what we would refer to frequently as our cheekbones. So here is a zygomatic bone. A couple more bones. The ethmoid bone is a little bit challenging to see. I think the easiest way to visualize it is through the superior view, and so you can see this highlighted bone right there, or right here. And all of those tiny little holes, perforations that you can see in the ethmoid bone, those are spaces so that neurons of the olfactory tract have the ability to, or can travel up through that ethmoid bone into the brain. So our sense of smell is enabled by those tiny little perforations in that ethmoid bone. The last bone that we are going to be looking at of the skull is the sphenoid bone, and it's this sort of butterfly-shaped bone that we can see from the superior view right here, the sphenoid bone. And one of the interesting structures on the sphenoid bone is called the sella turcica, and it's located sort of right here, right in here, or right in here. And if you were to look at it from the side, it's a bit of a divot, and the name of this landmark is the sella turcica, which is Latin for Turkish saddle, because it looked to early anatomists like a particular type of saddle that people who lived in Turkey or in the Ottoman area would use to ride horses. So it's the sella turcica right here, and this divot in the bone is where the pituitary gland rests. And we will talk lots and lots about the pituitary gland later in A&P, mostly in A&P 2. So of the axial skeleton, we have the length of the spinal column, or all of our vertebrae, and between each of these vertebrae we have intervertebral discs, which are made up of a strong fibrous cartilage. If you've ever heard of somebody say that they know somebody who has a bulging disc or a ruptured disc, it is referring to this cartilage that separates the vertebrae. So the vertebrae are composed of several different regions. Okay? We have our cervical vertebrae. There are 7 cervical vertebrae in the neck area, we know, right? Because it's the cervical region. We have 12 thoracic vertebrae, okay? And we have 5 lumbar vertebrae. Sometimes a mnemonic that people use to remember that is breakfast at 7, lunch at noon, dinner at 5. Okay? The sacrum is right down here and is composed of fused bones, and the coccyx or tailbone is right down here and is also composed of fused bones. So if we're looking at the vertebrae themselves, they have some specific structures. Okay? They have, there's the body of the vertebra, which we see right here. Okay? And then there are several different holes and processes. So if we know that a hole in a bone is called a foramen, this right here is going to be the vertebral foramen, and that is the hole through which the spinal cord passes. Then there are also some processes or sort of pokey bits in the vertebrae. There is the spinous process, and this is the posterior part of the vertebra. So if you feel your the bumps on your back, you're feeling the spinous processes of your vertebrae. And there are also two transverse processes, one right here and one right here on each vertebra. There are some specific things that we will look at with our cervical vertebrae. So here, right up here, are 7 vertebrae of the neck. Okay. One of the things that's different is that these vertebrae, these 7 vertebrae, have holes in their transverse processes, which you can see right there, or this lateral view, and these are called the transverse foramina. So a foramen is a singular hole in a bone, so here's the vertebral foramen, and these 2 holes are the transverse foramina. And these cervical vertebrae have those transverse foramina because the blood supply that leads up to the brain travels through those. We are also going to identify the first 2 cervical vertebrae. So the first cervical vertebra is C1 right here, also described as the Atlas. Okay, and you can think about the mythological figure of Atlas carried the weight of the world on his shoulders. And so this bone, C1, right here, okay, carries the weight of the skull on its shoulders. And the atlas articulates with C2, which is the axis. And they have this very cool articulation that is unique, and it is one of the things that allows us to shake our head right and left. So again, we have the rest of the portions of the spine, including the thoracic vertebrae, the lumbar vertebrae, the sacrum, and the coccyx. Okay. Or right here, cervical, thoracic, lumbar, sacrum, and coccyx. And finally, we have our sternum and our ribs. Okay, so here is the sternum, or our breastbone. And there are a couple of landmarks of the sternum that I want to point out. Right up here is the manubrium of the sternum, the top of the sternum, sort of shield shaped. And right down here, this is the xiphoid process of the sternum. If you've ever taken a CPR class, people might have commented that you need to be careful to make sure that you don't rupture that xiphoid process. So the whole bone itself is the sternum that has those 2 landmarks. Then we also have all of our ribs, 12 pairs of ribs, okay, or 12 sets of ribs on each side of the body, okay, that articulate either with the sternum or with some cartilage here. And so that basically wraps up the axial skeleton, except for what you briefly mentioned, which is the hyoid bone. We find the hyoid bone here in the neck, and this is unusual because it is the only bone that does not articulate with another bone. All of the rest of the bones in the body articulate or are involved in a joint with or are connected to another bone. If we think of that old song, like the knee bone's connected to the thigh bone, the hyoid bone is connected to no other bone. It is held in place just with connective tissues. So it's unique in that way. So this introduces you to the major structures of the axial skeleton that we will be covering. Please be in touch if you have any questions.